Johnson & Johnson, they're known for their diapers and their no teary eyes baby soap. Johnson & Johnson made more than anybody during the opioid pandemic. They were literally growing. They were doing what people do in the marijuana trade. They were basically juicing up and synthetically altering opioid plants to grow faster and more potent so they could turn them over quicker. And so they supplied all the opium into the United States and made billions of dollars, going to all these governmental bodies and saying, look, this shit's getting crazy. Like, this is getting out of control. The addiction rates are through the roof. What Purdue did at that time was pivot and go out and educate doctors on breakthrough pain. These patients aren't addicted, they're just still in pain. And the way to fix it is to write them more opioids. So they launched a 200 milligram pill and gave people more opioids. There is a documentary, and it's tragic. It's this Mormon family, and he talks about this is the level of bravado that physicians oftentimes have. His wife, they grew up Mormon, and they had been married. They had multiple kids, and the story is his wife got in a car wreck, injured her neck, and was doing okay. She was seeing a primary care doctor, and a neighbor said, you need to go to the pain clinic and go meet Dr. So-and-so. Long story short, he puts her on Oxy, he puts her on a bunch of other meds. She ends up passing out all over the house. The husband's like taking pictures of her to document for the doctor, and she ends up in the ER at one point. After she gets out, they put her in rehab, they get her clean again, and that doctor's practice reaches back out and asks to meet with the family and the wife. And the doctor said, I and I alone will make the medical decisions on my patient, not you. So are we on the same page here? And this guy said, I looked him in the eye and I said, yes, sir. Anyways, the guy's wife OD'd and died like literally a month later. Ugh. And so they're suing the doctor, they're suing his practice.
So the doctor got her back on pills?
The doctor got her back on pills.
And what was his justification?
This is where it gets so tough, because when you're in it, like when I was in it, like erectile dysfunction and Viagra, like I said, Cialis, that's fun, right? But some of the drugs you are really passionate about. I mean, the narrative they spin in this is he made hundreds of thousands of dollars in consulting fees from Purdue Pharma and was paid as a consultant, and over a time span made, I think, like $300,000 or $400,000 off Purdue Pharma. And so, of course, he's going to push Purdue Pharma's product. Right. Is the narrative. But what I saw a lot was you begin to drink the Kool-Aid and bleed the belief, if that makes sense. Like, we're changing the world. We're going to launch these pain meds, and they're going to help.
Because you're being financially incentivized for it, so you have a reason to think.
You have a reason to be skewed, and then you're opening the door to let yourself be educated in a biased manner. Does that make sense? You're only listening to half the narrative, and that's a problem. And a lot of times physicians are listening to the big pharma company rather than their patients. We had a drug, Strattera, and it wasn't like a dangerous drug. It was a really safe drug meant to treat children with ADHD. And I was passionate about it. Like, I believed in it because I fucking failed kindergarten. I literally went to pre-first. There were kids in my class with helmets because I was ADHD and dyslexic. And at the time, the only thing on the market was Ritalin. And they said, we want your son on Ritalin, or we're recommending that he goes to like special education, basically. So I had to go to a pre-first. And then I jumped forward. I'm 23 and had graduated college, and I'm making great money. And I see this drug that is non-abusive, non-addictive, that we could be using to treat ADHD in kids and have them not go through all the headaches that I went through as like an ADHD kid. I was like, this is amazing, instead of Adderall and all these stuff. And so you bleed it. Like, you get really passionate about it when you buy in, and nothing bad ever happened with that drug.
I mean, that's kind of always the case, that they exaggerate the benefits.
Well, the biggest challenge is not only the exaggeration potentially of the benefits, it's if they begin to re-engineer or apply it to a different disease state. I'm trying to think of an example that would be a good one to give you. They can take a drug and the patent's about to expire. All right, so let's say they have a year left on the patent. At that point, the company will begin to say, how do we extend the patent so we can continue to get insurance coverage and get paid and hit our numbers for Wall Street? we've got to get another indication. So when they resubmit for a new indication based off just efficacy, they do not have to go back and do safety studies. And so they don't do human trials. Yeah, it may have been safe, as a osteoporosis drug in 60-year-old women, but is it safe now that you're using it in a 20-year-old girl? That's the type of stuff that happens all the time. And the guy who approved Purdue Pharma, this is the craziest part, the one who helped them draft their agreement and all of that, guess where he went to work 18 months later? Purdue Pharma. Making $300,000 a year.
Which is always the case, whether it's in the financial sector or in medical.
Yeah.
Right? That's what they do. Mm-hmm. They always wind up working for some enormous corporation after they set the regulations that would benefit that corporation. They get a cushy job.
Yeah, I think it was 12 out of the last 15 heads of the FDA have taken jobs in private industry for a big medical or a big pharma.
God.